Welcome to another episode of The Floss Boss. You Can Handle the Tooth. So this is Dr. Griffin, and I'm happy to be here live with you for our weekly series show. We did one last week, which was a lot of fun, had a lot of follow-up questions on it. It was on crowns. And this week we're going to talk about fillings. And I do need to mention a couple of things first. Number one, this is 100% raw. There's no notes or paperwork. That's part of the gig. The second thing is any questions that might come in. Just remember the kind of advice that I might give is not a diagnosis in any way. It's just us having a conversation about some things that perhaps your dentist may be recommending, and you're just trying to make a better decision. And so I'm going to help you answer some of those questions. All right, so I still get questions every day on the differences between mercury fillings and composite fillings. So not all tooth-colored fillings are the same, because some tooth-colored fillings are made of porcelain and some of them are made of composite resin. So in this picture, I don't know if you can see very good, but you've got some mercury fillings here and then some tooth-colored ones down here. And this is a porcelain one, but we're just going to talk about the fillings, okay? So the reason you might need a filling could be for a couple of reasons. Number one, it could be because there's a fracture or a chip in a tooth. Could be because there's some decay. And so then your dentist would recommend a filling, because the filling will help re-strengthen the tooth, and then you'll be able to eat or smile and carry on right normally. So the kind of fillings that have been done for decades and decades and decades are the silver mercury fillings. And they have served dentistry very, very well for many decades. So they are a type of material that is metal. It's an amalgam of metals, and one of those metals happens to be mercury. And so basically, where you have a broken tooth or a cavity, the dentist would prepare the tooth, and then they would take this metal in a malleable or moldable form and place it in that hole that's in the tooth and rebuild the tooth. And it's silver looking, but it functions very well. So what are the advantages to these mercury fillings? The advantages are they last a long time. They are forgiving, technically speaking, in a environment with saliva and moisture. So the amalgam is a forgiving material like that, and you can use them for bigger problems or bigger fractures. If you are sometimes if a tooth breaks, it's pretty bad, and then it could need a crown. But there's sometimes dentists will even use these mercury fillings to replace a cusp, to do something that big. So the other advantage to these silver fillings is that they can be cheap. They're relatively cheap, and they're quick, and they last a long time. What are the disadvantages to these silver fillings? Well, almost certainly, I'd say nearly 100% of the time, they will fail eventually, like everything else does. And eventually, you're going to get decay up underneath this mercury filling. So when the decay gets underneath it, you have to take out the old filling and more, where the decay or the tooth is now damaged underneath it. So then it becomes bigger. They usually grow up to be crowns. The other disadvantage to mercury fillings is that they're hard. They're really, really hard substance. So when your teeth, they're harder than even enamel. So when your enamel pounds on this mercury filling, it can be unkind to teeth. That's the best way to put it. So it can actually cause little fractures in the teeth. It can even cause teeth to break, because when your teeth bite on the silver filling over a long period of time, the filling acts as a wedge and just pries apart those cusps. Anyway, that's the advantages and disadvantages to the mercury fillings. There's also composite resin fillings that came about probably mid-80s. Dentists started doing them. Aesthetically, much more pleasing to the eye. So the advantages to the composite tooth-colored fillings, you use them for the same reason, if there's decay or a fracture or chip in a tooth. But the advantages are that looks really good. Whenever it does fail, it usually does not fail underneath because it is chemically bonded to the tooth. And so you'll just have problems maybe that occur around the edges or on the top. And so they usually don't create a worse situation in the long run. Another advantage is if you do have a problem with them, usually they can be patched. And usually when you think of patching something, you don't think of that as a good thing. But these tooth-colored fillings can definitely be patched. So where you can go in and just take out the bad part and you can then rebond new filling material right there on the top. So that's a big advantage. A disadvantage to them, they sometimes can be a little more expensive. Another disadvantage is if you put a tooth-colored filling and an amalgam next to each other, the amalgam is harder, so the tooth-colored filling won't last as long. Usually, it will wear down. Now, if I will say this though, this is true. If the composite resin filling is placed in a way that it's indicated, in other words, they're not really meant to replace a couple of cusps on those back teeth. So if it's used in a way that it's supposed to be, it can last for a long time, many years. So I don't want you to think that it's inferior or somehow a compromise to good treatment. It is good treatment, but when you just look at the raw material, the amalgam is harder and will last longer. The composite, another advantage I didn't mention, is it is kinder. Since it is a little bit softer, it's actually kinder to the teeth. So where you have a hole in the middle of a tooth, the tooth-colored filling can be bonded and strengthen those cusps a little bit. Also, the opposing tooth that is biting into that composite, it will wear a little kinder to your existing teeth. That's about it for the differences between amalgam and composite as far as fillings go. So I don't know if we had any questions come in. So please, last time we had a couple of questions come in live, but then we had several questions that came throughout the rest of the day. So we look forward to getting those questions regarding amalgam versus composite resin, and I'll be sure to answer them personally. So this is Dr. J, the Floss Boss. I'm going to sign off now. Thanks for joining us for You Can't Handle the Tooth, and we'll see you next week.